everybody, and welcome to JARG, the podcast that brings you information and education on endometriosis and adenomyosis. On this episode, I'm joined by Noelle Corrigan, who is a CORU registered dietitian with a very specialist interest in endometriosis. Noelle, welcome to the podcast. Could you give us a wee introduction and tell us a little bit about yourself?
Hey, Kathleen, thanks very much for having me. I have endometriosis and I'm also a dietitian, so I have a personal and a professional interest in this whole area. I suppose I can start with my own endo journey. Really, I had my last surgery in April in 2023, but it goes back, I suppose, way back. I started my periods at 13. Nothing very eventful, very normal for me, had no issues. I went on the pill then when I was 19. Was on the pill for most of my 20s. I kind of now know that that was masking a lot of my symptoms because my problem started when I came off the pill in the later stages of my 20s. My issues would very much been bowel related, very, very constipated and really painful to open my bowels. Like that lightning pain that people talk about. It's just, even when I say it now, I kind of get a shiver. It's just awful. That was one of my biggest issues. And then I had right-sided pain in my lower abdomen. It started really what just felt like a little pinch. Then it progressed to that kind of stabbing pain. I would have had a lot of issues when I'd have sex. The pain would last for 3 days after it, that pressure in my right side. I never linked the two of those together. I didn't know that there was going to be a link between maybe the bowel and that pain in the right side as well. So initially when I went to see my GP about those issues was certainly the right-sided pain. I know the first GP told me I was doing too many sit-ups and I had a chuckle. I definitely wasn't doing too many sit-ups. But I didn't push it at the time because I was able to manage it. It was okay. But then as it progressed, it got worse and worse and the bowels were getting worse. Went to another GP and then she referred me. She said, look, we have to get a scan. That could be a cyst. And it turned out it was a cyst. There was no mention of endometriosis at that stage at all. I just thought I was going for standard surgery to remove the cyst from my right ovary at that time. So I had that surgery in Dublin and then I woke up from that surgery and the surgeon had said, great success. We got the cyst from the right ovary and there was no damage. It's fully intact. I thought happy days. He said, you have some endometriosis. The first time I kind of heard of it. And he said then, I don't know a lot about endometriosis, so I didn't go near it. I said, fair enough. You can imagine I got this information. I had just woken up from the surgery, so I wasn't really taking it all in, to be honest. I was just delighted that I went to get a cyst removed and the cyst was gone and my ovary was fine. So I went home. So I put on the pill back to my GP. Didn't think anything of that really at the time. Then started my own research into the whole area of endometriosis then. And then the penny was dropping. Okay, this is something bigger. Definitely something more was going on. I was going to probably need more help further down the line. Didn't do anything about it because I got such a symptom relief from that surgery with the cyst gone. Kind of okay for a while. COVID hit as well. So I was like, well, I'm not going to see a gynae now. Probably won't get into one, etc. Kicked it down the line like kind of a lot of us do. In the meantime, my sister was talking about a friend of a friend who had gone to Romania for surgery for endometriosis. And I thought, that's interesting. I wonder why she went to Romania or what's the story. So I got in contact and that girl happened to be Johanna, who you had on your podcast already. And she was very giving of her time and her explanation about why she travelled for surgery, her endo story. In the meantime, I had done my own research. So I actually had booked in with Peter Barton Smith in London. So I did fly over and I had my scans with him. And that was the first time really somebody, a health professional, had sat down with me, explained endometriosis, and then was able to explain that I had lesions on my bowel. I had it wrapped on my ureter and I had deep infiltrating endometriosis. So while I was relieved and happy to get an explanation from a healthcare professional, there was huge emotions. Like I was upset, I was angry, and then now I was scared. And I knew I really wanted the surgery then at that point. So lucky enough, I have private health insurance. So I went back and said, I'm going to go here to London. I want to have the surgery. They weren't able to cover it then in the full amount. Peter Barton Smith, I know you're probably aware of him, does the robotic surgery, which is quite expensive. And I wasn't in a position that I was going to be able to cover kind of the full cost myself either. So I went back to Trina for more advice, and I'm so grateful for her and everything that she gave of her time and all her knowledge that she passed on to me. And she just said, I don't think you'll regret going to Romania. So from there, I sent the email, and anyone who knows who was in touch with Dr. Metroy and the team over there, from the minute you send the email, the standard of care that you get is just second to none. So just 7 months ago today, I had the surgery with them. It was a complete success, full excision surgery. And I just can't explain how life-changing it's been. Like, my bowels are working like normal. Like, I remember even the first few days after it, I was like, this is what it's like to have normal bowels, to not think about it all of the time and it dictates your whole day. So yeah, 7 months on now, really happy that I made that decision. The professional end of things, of being a dietitian and where that comes in, during that time when you get your diagnosis, or even before your diagnosis for many people, and you're searching the internet and loads of information is coming at you, and misinformation, and I just felt that's not right. And I have a science background and I'm a qualified dietitian, and I still was overwhelmed and paid out money for different things here, there and everywhere. So it's just, I felt it was so important that there'd be something that was more regulated. And I knew that as a dietitian then, in my personal experience, that I'd be able to offer that to people in that more kind of regulated, qualified space. So I set up my own private practice now, and I work with people who have endometriosis to help them work through any issues with nutrition that they have. And we can go into that in more detail now as the session goes on.
I thought it's brilliant, and I'm delighted to hear that you're well on the road to recovery, because that first 6 or 7 months is really where you see progress on some days, and other days you sort of feel, oh, it's still very difficult. But it's great when you sort of get to that point, and it's a good turning point as well too. But those first normal bowel movements and that sort of not planning your day around that is fantastic feeling. Yeah. And you've touched on a couple of things there that I think are important to go back on, is that, you know, as patients, we don't necessarily put everything together. We don't realize that those IBS type symptoms, you know, maybe, and the painful sex are related. Or is that chronic fatigue that we're experiencing, is that down to the bowel side, or is it down to something else? And that brings up a huge thing around awareness and education as well, doesn't it? And I think too, you know, the fact that a lot of surgeons are not putting those pieces together. And in particular, if somebody has an endometrioma, I always sort of refer to it as something that keeps sort of bad company. It's very rare that an endometrioma is there on its own when you don't have additional endometriosis. And it's nearly always found with deep infiltrating endometriosis as well. And it's getting that level of education and awareness, not really just out to patients, but out to their healthcare providers as well, that if you do see an endometrioma, you need to look at the company that it's keeping. And it's good that your surgeon actually didn't attempt to do any more than what they did, because that makes the subsequent excision surgeries a lot more difficult as well. On the dietitian side, I know certainly diet is a huge hot topic for the community, and always has been. And it's one of those things where we always feel it's something that we can change ourselves. It's very positive. So can you tell me the sort of role in nutrition and how that can sort of help somebody with endometriosis?
Absolutely, yeah. And we're in a space, like, we know obviously endometriosis is systemic, it's an inflammatory process, and people who present with it will have kind of 3 hallmark features where nutrition can play a role. We're talking about gut dysfunction, inflammation, and hormonal issues. Just where we are at the moment, Kathleen, I suppose we don't have a whole lot of research in general for endometriosis. We've even less for endometriosis and nutrition. And I'm like hoping and praying that we see improvements with that in years to come. It's not going to happen overnight. It will take time. So we're trying to apply what we know about IBS, what we know about inflammation and maybe hormones, and apply that where we won't necessarily have the specific endometriosis studies yet. Hopefully we will in the future. But we know that nutrition can play a role in gut dysfunction, in inflammation and the hormones. So that's really where I kind of tackle with my patients on that one. It's important to note, I suppose, at this time, and I know Johanna would have mentioned it as well, about informed consent before I go into all the details about the different things. You'll see on my website that I offer a free kind of video call if anyone wants to avail of my services. It's just important that everyone has a basic understanding of the disease and the severity, and that they have informed consent before they take on the nutrition program with me, whether that's 1 or 2 sessions. So just say, for example, if I had decided I wasn't going to go for the surgery and I was going to go down maybe just the nutrition route, Could have it grown into my bowel? Yes. Could have it grown and damaged my kidney? Yes. And unfortunately, sometimes people don't have that awareness, and it's just important that they would have that. So I'd give 15 minutes just to kind of gauge where somebody is at. And then by all means, we work forward, because nutrition can play a role in symptom alleviation. We know that. And we go and look at the gut things, the inflammation and the hormones from there. It's just so important as well that you're getting that advice from a dietitian, because usually, well, not always, but endometriosis just won't be standalone. Like, people might have PCOS as well. They might have a thyroid disorder. Unfortunately, what we're seeing a lot is disordered eating among this group. There's going to be food intolerances, and a dietitian will have the skills and knowledge to look at the big picture and then give you the personalised advice based on your medical history. Because obviously you want symptom relief, you want pain relief, you want to sort your bowels, but there is the bigger picture too, that are you serving your other medical conditions as well, and are you looking to the future? Look, towards a DEXA scan, do you have enough calcium? We can go through all those as well. So yeah, that's kind of the areas we look at. Like, I can go through what typical kind of sessions would be with me in terms of all the detail. If we sign up, if I have informed consent and we're going to move forward and they want to look at nutrition to alleviate some of their symptoms, I'll always start with the gut issues, because if somebody is coming to me bent over with constipation and pain, or they're suffering from diarrhea, we need to try and tackle that first before I start talking about recipes and Mediterranean style lifestyle. Like, that's just not going to cut it. We need to go for the gut issues first. There are first line approaches that you can take that we would recommend for everyone to trial before we go into more specific FODMAP diets and so on. They're the very basic things that sometimes we skip over. Are you chewing your meals? Are you taking your time over your meals, or are you inhaling your meal over the kitchen sink? Are you practicing your breathing? And I know physios are very good to remind us of the importance of our breath, because if we're in this chronic stress situation, well, then we're not giving our digestive system the best chance for shutting it off. So all of these basic things, as I said, hydration, your breathing, your movement, we'll try all those first. Try avoiding very high fat meals, because we know that can have a very sluggish effect on your digestion and slow you down. If you don't have any relief with those, and some people go away for a week or two and say, I've noticed a huge amount of difference in my bloating, in my bowels. I'm going to continue this and go forward. Other people won't get any relief from that, and they might need to start looking into what we call the low FODMAP diet. So in that case, people will have individual food triggers. And usually what people do is they go to the internet, they Google it, and they might pull out, say, something, they just pull out dairy and go for it and never put it back into their diet. There's dangers with that. And again, it's so important to work with a dietitian if you're going to do an elimination diet. What basically it is, if we talk about the FODMAP diet specifically, I'll just take fructans, for example. So fructan is a FODMAP that's in the likes of your onion and your garlic. It can be bothersome for some people. With the low FODMAP diet, you'll pull out the onions and garlic for a certain amount of time. Generally, people will get some symptom relief. Then you'll reintroduce the onion and garlic in smaller amounts and try and find the tolerance for that individual. And with that, you'll do it for all the FODMAP foods, and then you'll make a more personalised approach for the person. What generally happens is people love the elimination phase because they get symptom-free and they want to stay there forever. And if you don't have somebody like me telling you, well, look, I'm thinking of your DEXA scan 10 years down the line, and if you have no dairy or you're low in calcium, what's that going to look like for you in 10 years' time? Also, if you're removing all kind of carbs or certain foods from your diet, where's your fiber coming from your gut health? So again, it's just important to have a dietitian in your corner to make you think about those and make you aware of those, so that you start reintroducing foods back into your diet. Once then we're happy enough that your bowels are to a stage that you're happy with, that maybe you have helped your constipation as much as you can or solved your diarrhea, I'll start talking a little bit about inflammation. And in there, what we're talking about, we know endo is an inflammatory process. The closest thing to the best anti-inflammatory diet we have out there is what you've probably heard of, the Mediterranean style diet. So I will educate people around what that is, provide some recipes and advice on how to start getting that kind of a lifestyle, the eating and lifestyle around that Mediterranean style that will help with inflammation. What does that look like? We're very aware of some of the advice: colourful fruits and veggies, your extra virgin olive oil, your nuts and seeds, your herbs and spices, limiting the likes of your red meat and processed foods. What else do we want to look out for? All of that kind of comes in together in the Mediterranean style diet. You want to try and avoid processed meats as much as possible, like the likes of your salami, sausages. Again, I'd work with the individual around their kind of needs and what they want and what they want to incorporate. But that's just around a level of education and trying to be more anti-inflammatory instead of being pro-inflammatory. So again, education and providing support with recipes for that. After that, we'll then go and look at, and I think hormones is something that's splashed all around the internet when we go and look at hormones and diet and hormonal impact. And where we're at, I suppose, at the moment, we know that there is a gut and hormonal link. Do we have lots of evidence for endometriosis and our specific impact on diet and specific hormones? Not really. We still need so much more studies. When we talk about gut health, we're really talking about all the bacteria that live down in our large intestine, and the more diversity we can have down there, the better. There's a specific family of bacteria that live down there called the estrobolome, and they have an impact on estrogen and estrogen levels. So there is some areas of study that are looking into the effect of the estrobolome and on endometriosis. Again, very early, we don't have a huge amount of research on it. But from a dietetic point of view, what am I looking at when somebody's in front of me? Well, how do we optimize your gut health? Where are you with your fiber? Are you including fermented foods? Things like your kombucha, your yogurts, your kefir, because they have the live bacteria in them, and that can have an impact as well on your gut health. So that's another area that I'll do lots of education around, provide recipes and any information that the client would like going forward with that. So that's kind of a typical outline. Again, it's very personalised, Kathleen. Somebody will, but even the gut issues are very personal. Some person will have diarrhea, the next person will have constipation, one person will have lots of bloating. We know that endometriosis itself is very individual. Even if you or I were to discuss where our lesions were, I bet you they weren't in the same place. People can have it, we know it, on their lungs. I had it around my kidney and my bowel. So it is very individual. Therefore, the symptoms are going to be very individual. Therefore, the advice I provide is going to be very individual. So it's that knock-on effect. But yeah.
And that's so important to recognise that individuality as well, isn't it? And people will have certain cultural preferences or certain personal preferences around diet and nutrition as well, which is, I'm sure, is very important. And I think it's important too for people to realise that you don't need to have endometriosis on your bowel or your bladder for either of those organs to give you a symptom or to have that effect, because we've got that huge sort of toxic inflammatory environment in the peritoneal fluid that can cause that sort of irritation as well. And we do hear people describe, that when they have their period, sometimes their bowel, it goes absolutely haywire. You have the sort of period poops, as people describe them, but that can be really severe and debilitating diarrhea and fluid loss as well. And that all needs to be taken into that balance. And I suppose the very first introduction I had to where nutrition was going to play a role was Diane Shepperson-Mill's book. And that's a long number of years back. And the research hasn't moved on. I've been to a number of conferences and somebody will present a paper on a very, maybe a micronutrient and, this may have an effect. But again, like all endometriosis things, the research is so poor. The populations they're looking at are not great. And they tend to mix up endometriosis symptoms with endometriosis as the disease. And as an individual at the end point of that process, we probably really don't need to know the ins and outs. We need to know what's going to make us feel better. And I think that's where your approach is fantastic. So when we're in the middle of an absolute horrendous pain flare, or we've had a period maybe where it's gone a couple of months now, we're drained, like maybe our iron levels are starting to drop, our fatigue is high, things are starting to go off, and people sort of think, oh, this is going to be hard to stick to. Do you find that people sort of take to the plan, and once they start to see improvements in their own individual, is it easier to stick to?
Absolutely. Like with anything, if you get a little bit of success, it can help you to kind of believe in the power of nutrition as well. Um, but then there are times, and that's the frustrating thing with endometriosis, where you'll have a flare and it sends you back, and you're in bed and you're like, I couldn't be bothered cooking anything, or I couldn't be. And what I say to people is, what, don't have any guilt around that. If you're going to have 1 or 2 days, maybe where your diet isn't perfect, even though what is perfect, that's not going to have that big of an issue. Give yourself a break. Get somebody else to cook you up a meal, or if you could even manage a smoothie that was balanced with a bit of porridge in there, a bit of fruit, maybe a bit of spinach, if you could manage that. If not, don't beat yourself up. Give yourself that time and space. And of course, you can reset. And sometimes even I'll have to say that to my clients, be like, I'm giving you some information now because we're meeting at this time. Maybe it's a case that you leave it there and you come back to it in a month when you're ready for it, when you're ready to implement those changes. Because as I know, when you're in the middle of a flare in the pain, you might have the interest in or the strength or ability to do that. Longer term, we have our end goal where we want to get your gut health as best as we can. We want to have an impact on your pain. That's where we want to go longer term. But it's definitely a marathon. It doesn't happen overnight. You don't make the huge jump in progress overnight, nor does one day or night completely eliminate the progress that you've made. So I think we carry enough guilt, Kathleen, and we carry enough worry with the disease that we don't want to add to it. We don't want this to be another thing that we have to worry or beat ourselves up about, because we're trying to figure everything else out in our head. We don't want to have that on top of it too. So a lot of the time I'm kind of getting that across to my patients too, that number one, you're here with me and you're giving yourself the time and space, and that's brilliant. Don't beat yourself up about being perfect, because we don't know what perfect is. Yes, we're working towards the end goal of getting your gut health really strong and in the best position we can be. But cut yourself some slack too, which is really important.
That it's so important, because, as you say, we carry a huge amount of guilt. A lot of guilt comes with this condition as it is.
Yeah.
And we have, certainly, we have this sort of female guilt as well, that we need to be able to do everything and perform and work and do everything that we're supposed to do. And it sort of piles on as well. And this is, I think, why the holistic approach is so important. And I spoke to Orla Reid as well in the podcast, and, from a psychological support point of view. And it is one of those things where all of these things fit together, because she had mentioned disordered eating as well too, and you've mentioned it here. And this not just ties into the physiological thing, but it ties into the psychological as well, because I know if I'm going to eat a food that's going to leave me either very, very sick, or it's going to leave me in pain for a prolonged period of time, very similar like painful sex, if we know that's going to be 3 days, you're starting to think, is this worth it? So when you have something like that with food, you can see where those triggers and those sort of things, you're like, okay, I might just be better cutting out everything that remotely looks like a grain or, a carbohydrate.
Mm-hmm.
And, if you have somebody who maybe has quite disordered eating, so maybe they're stress eating, or maybe they're not eating and not nourishing themselves, can you work with somebody like that who maybe quite iron deficient, maybe their B12's low, maybe they have no routine at all in terms of food. They might be, relying on basically snacks and toast. How can we sort of get back from that?
Absolutely. Well, there's a couple of layers to it. Obviously, there's some people who might have the deficiency, like maybe vitamin D or your iron or your B12, and I can work with that area too. Or people even just trying to establish their routine and they need support with that around recipes that might be very easy for them in their situation. I can help with that. If it's a case where it's a true disordered eating, that unfortunately is the case with some people, we have very specialist dietitians who would work in that area of disordered eating. And we know the website BodyWise is there for that particular thing. So if it's a case where it's a true disordered eating, it wouldn't be my area of expertise. And I definitely have to pass that on to somebody within that scope of disordered eating dietitian who would have worked with patients for years. But if it's a case where it is just your deficiencies, your general lack of routine or lack of kind of resources and recipes, and how do I cook, where do I start, how do I go to the supermarket and make my list, definitely I can help you with all those. But just to be very clear that if it was, and if I felt myself that it was kind of a deeper level of disordered eating that I would be referring on at that point. It would be my duty of care to do that. So yeah, just the awareness about that. And it's interesting that Orla had mentioned that as well, because it's not something that I would necessarily have thought about before I started out on this journey, but it's something that I am seeing more and more. So there definitely needs to be more awareness of it, and just that I can signpost people onto that more kind of a dietitian who would have years of training in the disordered eating space. Yeah.
Yeah, and this is one of the reasons I find it very important to deal with professionals who are on a professional register. Like, I'm a CORU registered medical scientist. You're on the CORU register as a dietitian. Connor, who I spoke to recently, was as well. And Orla's registered with her professional body. And I think that's very important, that we recognise our limitations. And we say, this is not my area of expertise, but I have a colleague who's able to help, and we can refer and pass people on. I think that's really, really important, because we're doing somebody a disservice if we can say that we're all things to everybody.
100%.
I think that's really important. So can you take me through maybe the process for somebody who's not aware maybe of the likes of CORU or Indie, like where you have a register? What does that mean to you as an individual, and how does that protect the public?
Absolutely, yeah. So I'm a CORU registered dietitian, and you'll have physios, occupational therapists, and CORU is there to protect the people. It is a registration where I renew my registration every year, but to stay on that registration, I have to complete CPD. So I have to do a certain amount of reading every year and CPD, so I'm up to date with the latest evidence. And also, at any point within that year, CORU can ask for evidence of that, which is really, really important from that point of view. And just to mention that, because people are turning to, say, Instagram for their information, Kathleen, and in Ireland, we're called registered dietitians. So you might see somebody with RD behind their name. It's the same in England. If you have a dietitian in Australia, it's called an accredited practicing dietitian, an APD. Just for anyone, if you're turning to Instagram, because I know a lot of people do further diet information, just check that the person that you're getting off would be registered with their body. So in Ireland, RD, you will see. Any of the Aussie dietitians, because I know they have a lot of interest in it, will be APD. And that then at least that that's a protected title, they're registered, and they have to do a certain amount of CPD, so they're up to date with all the latest evidence. INDI is another place. So the INDI, for anyone who doesn't know, is called the Irish Nutrition and Dietetic Institute, and they have a page called Find a Dietitian. So you'll find me on that page, but you'll find all the dietitians in Ireland. Obviously, dietitians can help you if you have kidney disease, liver disease, diabetes, a whole plethora of medical issues. As far as I'm aware, I'm the only one who's just looking after people who have endometriosis. I could be corrected on that. I might get an email after the show, but it's quite kind of unique. I suppose I have the personal and professional interest in it. But anyway, the INDI Find a Dietitian page. And often if somebody comes up to me saying, look, I want a dietitian for X, Y, and Z, I said, well, that's your first port to call, because they're listed there. And even if you do contact somebody on that and they're not the right person, well, they'll signpost you to the right person then. So at least you're getting the right advice and that it's all evidence-based. So it's so important.
It's very important, because we know now that so many people are getting their medical and health information from social media, and it's a very scary line at the moment. There's a lot of misinformation out there. There's a misinformation about almost everything. Endometriosis is not immune to that, and nutritional information seems to be one of those ones where it's huge, and it's frightening as well, because you've got a potential for a lot of harm. Mm-hmm. So it's, again, very important to look for somebody, on the register and in your area, and as well somebody that you're comfortable with. You need to gel with the person. So I think that's important too, that you need to trust, if they have a lived experience of a particular thing, but if they don't, that they're also empathetic and they're open to that research. Yeah. And I think too, because like yourself, I have to do my own CPD, and for anybody who's not familiar, that's continual professional development. So we have to read the research, we have to reflect on it, and we have to write it up. And it makes you focus, and it makes you sort of think, well, what is going on out there in the world? How can I make sure that my knowledge keeps up to date? And that's quite a good thing as well, because it means then that if somebody has a particular area of interest, like yourself in endometriosis, you're very aware of what's going on. And have you seen anything yourself in the literature in the last couple of months that might give us a bit of hope, or do you think that we definitely need a lot more investment in that?
I think we need so much more investment in it, and like my fingers and toes and everything are crossed. It will take time, definitely. I definitely think that area of the gut health and the estrobolome and that effect on hormones, I'm fascinated with that area. Like we see the importance of gut health not only in endometriosis, but in a lot of chronic illnesses. And I think that could be maybe an area that might explode over the next couple of years. There might be more coming from that. So kind of watch the space with that one. Like you had Connor on last week or the week before, whenever it was. And I know Connor was probably a year ahead of me, I think, in college. I think it's absolutely fantastic that we have the likes of Connor in our corner as well. His research skills could prove very, very helpful for us in the next couple of years, hopefully. And I know his supplement looks very promising. And I'd just be interested to hear back from that as well, to how it's received in the community too. So there is definitely, I'm going to say I'm quietly optimistic. Like you just always have to kind of fingers and toes crossed. And I'm just happy to be involved. And if I can help in any way, even if it's just helping one person, even if that's a chat for 10 minutes, like I'll always give that call if somebody makes contact with me, and just to give them a little bit of advice. They don't even have to sign up for 1 or 2 sessions with me. It's just to give them a chat, because I'm forever grateful for Johanna. That time when I went looking for advice, when I was, on my knees and I was vulnerable. And if I could do that and pay it forward, I'm more than happy to do it.
And that's where the power of advocacy and the power of peer support comes in so strongly, doesn't it? You don't know sometimes the impact you're going to have by having a conversation with somebody, or even by mentioning endometriosis or mentioning one of its symptoms, because that person might go away with that information and maybe 12 months later have somebody diagnosed within their family or even themselves, and they're able to use that information that was given. And I'm eternally grateful for the people who came before me, who educated me. And certainly, I've had fantastic feedback. And now I see the likes of Johanna and Orla and Amy and all the other advocates around me are doing a fantastic job in not just getting accurate information out there, but also like bringing the community together and bringing it from different points of view, because we are all so different. And I think that's a huge thing. And then we have somebody like Connor, who's come in from the outside as such, couldn't believe how the whole thing was with endometriosis, and was like, okay, there's a need here. And again, involving the community is so important. Like yourself, specialising in something like that, reaching out to the community and saying, look, I'm here to help. I'm here to sort of, start this journey with you. And involving them in any research is very important. Mm-hmm. And this is something I bang on about all the time, and people are probably fed up hearing me saying it, but you can't have research about a particular community like the endometriosis or chronic pain community without involving them. And that has to be active involvement from the very beginning, from design the study right up the whole way through to execution. And I think a lot of researchers and clinicians forget that patients are also professionals. We all, have varied backgrounds. Some of us are scientists, some of us are dietitians, some of us are doctors, some of us are nurses, some of us are researchers. So we can bring all those skills to the table. And that's something that we really need to sort of, get across to anybody. And there are some research projects, underway in Ireland into endometriosis. And that's, good to see. But again, I'm going to put it out there that we need to involve the community very strongly on this. Certainly the microbiome side is a fascinating side for me. And I think that's something that we're probably going to see a huge explosion in the next couple of years. I think that's going to be a big thing. And I know I put Connor on the spot by asking him, do we serve the bugs or do the bugs serve us? But I think at the minute it's a draw. I think we're sort of both benefiting each other. But is there anything that we could sort of take away from today? So one thing it's a personal thing. I don't like seeing this blanket idea of supplementation, but is there something maybe that as people living with endometriosis in general, is there something that we could sort of do or, start ourselves before we would even make that call to you?
Yeah, I think it's important. Number one, I'm big on eliminate that guilt. Okay, there's nothing that you're doing or not doing that is going to cause or cure your endometriosis. Don't feel like that from that point of view. I get what you mean about that blanket supplementation. the only blanket supplementation that we can stand behind is the vitamin D at the moment. Like, everyone in Ireland should be taking that. So I'm quite surprised sometimes some people are coming to me and they're not on a vitamin D supplement. So that's somewhere you could definitely start, or even just ask your GP for the blood test. That's always a way. Sometimes I'm surprised when people come to me and they haven't got their bloods done maybe in a while, so they don't know where they are with their iron or their vitamin D or their B12. So if you could have your bloods ready to rock, at least I can interpret them, and then we know where we're going with that. Some people don't like fish at all, so then it's okay to start taking your omega-3 supplement. In that case, if you have very little oily fish in your diet, that's okay. The other supplements like that, we just need more research, Kathleen. As you know, I can't go off and start saying take zinc, take C, take NAC. Yes, there's promise for sure, but I'd have to look at your individual diet to see where you're at with it. And after that, be patient with yourself. We can never be perfect. We're trying to aim to get to a place where you're optimizing your gut health. So are you trying to follow the Mediterranean style diet? Are you introducing a few fermented foods? Are you trying to get as much fiber that you can tolerate? Try all those things. But if there's a day where you're in bed and all you can do is have a smoothie, well, that's okay too. You'll be able to reset and re-go. And then if you want more personal advice, or if you're living with something like thyroid disease, PCOS, and you're finding it hard to manage it, and you're going to the internet and you're confused and you're feeling guilty, well then, yes, absolutely, I can sit down with you. We can go through all that for sure. Yeah.
It's recognizing that slow step-by-step progress, isn't it? And, not beating ourselves up on the bad days, and on the good days, realizing that, we're stronger than we even think that we are. And again, too, we are complex organisms. Endometriosis doesn't exist on its own. And, even the systemic effects of that can be down to so many things as well, too. Like vitamin D, a huge thing in Ireland, and certainly this far north in Ireland as well. Like, we very rarely see the sunlight as it is. And certainly the lab I work in, we do a huge amount of vitamin D testing. And the levels always surprise me. They're always quite low. And it's something that, there is some research out there to sort of back that up for a lot of different things. One of the things you did mention earlier on as well, too, and I just wanted to pick up on as well, is around this sort of hormone health and around, calcium and DEXA scanning. A lot of women are placed on long-term contraception. They may be placed on the GnRH analogues for management of their endometriosis symptoms. Now, we know these have a negative effect on bone health. My recommendation is that, people would have a DEXA scan, if possible, with the consent of their GP prior to starting treatment, and maybe a monitoring one after that. But during that time, if we have to, take a GnRHA to perhaps help with symptoms while we're waiting on surgery, or perhaps that's the treatment that we've chosen, can you safely supplement with calcium, or should we just rely on our diet for that?
Generally, I would always go with the food first approach as much as possible, but it's very individual. If someone is saying to me, like, I haven't eaten yogurt or drank milk in years, I don't do that, well, then we're going to have to look at a supplement, because they're not going to be able to get enough calcium in there. It just depends where they're at. So if their diet is okay, if they're meeting their calcium needs through the food, probably no issue with it. But if they're struggling, well, then you need to look at a supplement in that case. It's kind of on an individual basis, and then linking with the GP as well before he would obviously make that prescription on that one. But yeah, I think it's really interesting, Kathleen, because from online, people, it would say cut out dairy for endometriosis, and people are doing that all the time, and they get some relief, so they're delighted. But people don't think of long term and a DEXA scan and their bone health. That never ever. And when I say it to them, you can just see their eyes, and it's just the penny drop moment. They were like, I never thought of that. And it's understandable. You're only thinking about your pain because it's so bad in the moment. But long term, with that DEXA scan, like, where is your bone health going to be in 10 years' time if you have no calcium, or if some of the medications that you are on are interfering maybe with absorption? I think another place that's really good, and that we probably underutilize, are our pharmacists. Their knowledge and understanding of drug and nutrient interactions is second to none. but we don't naturally go into our pharmacist and ask. And anytime I've done it, they've been more than obliging and so informative. So don't be afraid if you're ever starting a medication or something that you go to your pharmacist and say, well, is this interacting with anything that I should be aware of? And then you can bring it to your GP and get your blood tested in that way. But definitely, I think they might be a profession that we underutilize a little bit here.
Absolutely. And pharmacists are often the first point of call for somebody who's developed endometriosis symptoms, because we're in looking for pain medication, usually over the counter. And they play a huge role in that, because a lot of women are on many complex medications as well during that time. Trying to get maybe a diagnosis or maybe go through fertility treatments. So that's a great resource to have, isn't it? And it brings together, I suppose, as well, that whole concept you brought up earlier of informed consent. Like, we don't know what we don't know. If we haven't been told the side effects of a medication or the long-term risks of eliminating something from our diet, or perhaps that it's going to interfere with maybe a blood test that's been done or something else that's going on, it's very, very difficult for the patient to absorb all that information if it hasn't been given there in the first place. And I think that, again, brings us all back to that sort of education process, isn't it? The more we can talk about things like this, the more patients can become empowered. And as well, too, the more medical professionals then can actually sort of, expand their knowledge and reach out within the patient community and sort of say, look, we recognize that, this is a multifaceted disease. Not one person's going to be able to help here. You're going to bring in all the tools in the toolbox and get everything together, because everything from, diet, nutrition, exercise, pelvic floor, physio, general OT, general movement basically is enough sometimes as well to, give you those 1% that can sort of help reduce the symptoms down and improve quality of life as well.
Yeah.
Nothing's 100%. Even with the surgery, I'm sure you found yourself that, before surgery, you're able to use your tools and skills to prepare, and after surgery as well to help in that recovery phase. Did you have any tips after surgery that you would share?
I didn't mention, but I did go to see a pelvic floor physio after my surgery, and that was hugely helpful. I hadn't gone before, and my pelvic floor was so tight after all the years, obviously, of tensing with the pain. And it made a huge difference. I would have went, say, maybe 2 months after the surgery, and it was just fantastic help as well. So I'd highly recommend a pelvic floor physiotherapist, and they're so helpful, and just really, really, any kind of lingering pain that I might have had after surgery, it was actually just that tight pelvic floor. And that's important, because sometimes after surgery, if you have a few niggles, you think, oh my God, it wasn't successful, or you start the guilt circle again. But the pelvic floor physio was just fantastic support. Again, in terms of diet and nutrition afterwards, you're in this lovely space if you've had the expert excision surgery, where you can now go and try and optimize your nutrition, go try and get your gut health. The only thing is, you're probably carrying years of food, maybe aversion, I'll call it now. So you have to try and relearn and grow to love food again. And what I'll say is, get a few recipes, try out a few recipes, get to a space where you're enjoying food again, and that it's not really dictating your life, whereby you're enjoying food, engaging with food, meeting with friends, eating. That's what I'd say. It's a nice space that you can kind of let go of the guilt and worry that you maybe had pre-surgery. And now you're in the space where, well, how can food and nutrition really add to my life now, and add to my gut health, and can I bring that forward? So it's an exciting time.
It's amazing, and it's a lovely positive time for change as well, isn't it?
Yeah.
And a time, as you say, we can go back to one of the social aspects of food that sometimes we miss out on. So it's very encouraging. And in terms of that, then, for any sort of additional support or resources, have you anything that you would have a go to? And certainly, I know I'm going to direct people towards your website. I'll pop all that in the show notes. But if there are any additional resources that you could direct people to?
Yeah, it's really tricky. There's not a huge amount out there yet, and like I always keep saying, I was always like, somebody should start a podcast. And then, lo and behold, Kathleen, you did it brilliant. I would really like to get a space, once I have more time, to write more on my website, where I'll have blogs and more information. So hopefully watch the space for that. Other than that, I'd say if you need a dietitian, it's the INDI. You'll find me there. But again, just a reminder, if you're getting your information from Instagram, it's a registered dietitian, RD or APD are the girls in Australia. Other than that, I don't have a specific website that I could say to you offhand. It's just not there yet. I know Connor was mentioning that maybe he plans to get that educational platform up and running, and my eyes just lit up when he said that. Like, wouldn't that be brilliant? So yeah, definitely just take a little bit of time, but it should get there.
Brilliant. Noelle, thank you so much for joining me today. It's been brilliant chatting to you, and I always learn so much chatting to so many different healthcare professionals and different people as well, through their own experiences with surgery, their own experiences with recovery, and how again they've brought all those pieces together. And I always say people are sick of hearing me going on about the 1% theory, but when you see it in reality where people have brought all these lovely pieces together, it's been brilliant. So thank you very much for joining me.
Thank you, Kathleen. I enjoyed it. Thanks a million.
No problem. And thanks everybody for listening to this episode of Jarg, and we'll chat to you all again soon.